In this video, we are going to answer the question, does penile curvature lead to infertility? Now, penile curvature is seen in about 10 to 20% of men. It's a very common phenomenon. And what happens is a large proportion of men will have some degree of penile curvature, anywhere ranging from 10 degrees to about 30 degrees. Now, when penile curvature is within the 30-degree limit, it's usually not a problem. Sexual intercourse can happen without difficulties. But in some men, where the penile curvature becomes more than 30 degrees, where it becomes 40 degrees or 50 degrees, and there, if you see the male patient's organ, male penis is usually tilted like this upward or severely on the sideway direction, right side deviation, or there'll be a severe left side deviation. Over there, these men cannot penetrate their partners. And sexual intercourse generally becomes very painful also, because you can't take a bent penis and insert it into a relatively straight vagina. It's a mechanical obstruction to penetration. In these scenarios, one must rule out Peyronie's disease, and it's very, very important. Not just Peyronie's disease. Well, Peyronie's disease is just one set of problems. Penile curvature can also be caused by penile injuries and untreated penile fractures. Sometimes patients will have, apart from Peyronie's disease, they'll have calcified nodules and other mass lesions within the penis that should also be evaluated properly. Now, what's important to bear in mind is that penile curvature can be treated, but the right solution would be which penile curvature to treat and which not to treat. Subtle curvature of the organ like 5 degree, 10 degree, 20 degree does not require any medical intervention at all. A simple physical examination with an andrologist or a sexologist to rule out and see that the penis is curved and it is within normal limits can general reassurance of the patient is all that's required. With severe curvatures, one must do an ultrasound penis and see within the organ for calcified nodules or calcified plaques within the organ, which would suggest to the treating physician that the patient may have what's called as Peyronie's disease. Now, when Peyronie's disease is there, the patient has to be followed up and evaluated, and suitable treatment options have to be given. It is vital to plan for a child early if a patient is diagnosed with Peyronie's disease. And why is that? Because when a patient has severe penile curvature and the curvature is so severe, that difficulties in penetrations are already starting to happen. The curvature or the severity of the curvature will become only worse over the years, and patients with Peyronie's disease slowly lose their erectile function. So systematically, there will be a decrease in the patient's erectile function as the years progress, and the curvature will become worse. So a true cause of infertility in patients who have penile curvature is Peyronie's disease. And once a patient is diagnosed with Peyronie's disease, it generally worsens over time. So if you notice that before marriage you're planning for marriage, or you're coming out of marriage, going into another marriage, and you notice that your organ is curved, please visit your andrologist or visit a sexologist near you and just rule out Peyronie's disease and check and see if the curvature is physiological, within limits, or it is abnormal. Hope you like the video. Please drop in your comments below. Please subscribe to the channel. Please extend your support. I'll try my best to answer to all the comments, and I'll see you soon with another video. This is Dr. Shah signing off for now, and see you soon.